So I will start off by extending our previously mentioned significance, inherency, and solvency claims. For our significance claim that the U.S. will benefit from universal health care, this is proven by looking at statistics provided by Taylor McKay, who writes for the Telescope in her article, Should the U.S. Have Universal Health Care?, written in 2008. She sheds light on the fact that 33 million Americans are without health care coverage. This is almost 10% of the United States population. These 33 million people are at risk for huge financial problems and health problems. Universal health care would work to protect them and cover them. And that's why the U.S. and its citizens will benefit from universal health care. To extend our inherency claim that the United States healthcare system is lagging behind compared to other countries, developed countries, information can be found on this in the article, Does Progress Towards Universal Health Coverage Improve Population Health by Rodrigo Serra and Peter Smith, 2012. It's revealed that compared with data from over 100 developed countries, the United States United States citizens are 25% more likely to have unmet health needs. This is almost unbelievable considering we are one of the wealthiest countries in the world. To catch up with the rest of the world, we need universal health care. As mentioned before, universal health care is obtainable for the United States. A recent Reuters poll in 2018 found that 70% of Americans support Medicare for All, or also known as universal health care. It is only a matter of time until this gets implemented in our society. And to resubstantiate some claims that our opponents made, our opponent's significance claim is flawed because universal health care will benefit the United States, especially the economy, which will result in benefits for citizens and the government as well. This is found by Alan Daziali and Robert Pinheiro in the article Health Insurance as a Productive Factor, written in 2012. This article explains that the U.S. economy loses 65 to 130 billion annually as a result of diminished worker productivity due to poor health and premature deaths among the uninsured. So what's happening here is that the uninsured workers are dying prematurely or taking work off because they're injured or need health attention. And due to this, they're not producing labor, which benefits our economy, which benefits the United States. Next, our opponent's other claim that universal health care will hurt our nation and not bring many benefits for any. This is also flawed because people are actually literally dying because of lack of health care. Universal health care can actually save lives. And it is found that preventable medical error ranks as the number 3 killer in the United States. Universal health care will bring government intervention in the United States healthcare system. And the healthcare system, as it is right now, desperately needs to be regulated, which universal health care will do, and prevent countless deaths that is seen as the number 3 killer in the United States. And finally, the opponents claim that the current system is not working for Americans. Their claim that the current system is working for Americans is also flawed. And this is due to the fact that also under the reason that healthcare desperately needs to be regulated by government intervention, which universal healthcare will do. 94% of physicians and nurses have worked with a colleague that fails to follow proper protocol. With universal healthcare, government intervention will regulate healthcare facilities and hire proper workers. And that is why universal healthcare is the best option.